In this video, our subject is entry into the workforce. We will discuss the competency evaluation, how to prepare for a job interview, and how to succeed once you land a job. Your training program has helped you to gain the knowledge and skills necessary to get you started in a career as a healthcare professional. You have learned how to care for many types of patients and residents in a variety of healthcare settings and situations. Now it's time to prepare for your entry into the workforce. That means it's time to demonstrate that you understand the fundamentals of your profession and that you are ready to use your skills and knowledge in real healthcare situations. And it means finding and holding a job. If you've ever held a job before, any kind of a job, you'll know that getting a job and holding a job require the same kind of skills and attitudes that make for a good student. A willingness to work hard, a commitment to honesty and fairness, and a professional attitude toward your work. Professional. Just what does that mean? Well, to be a professional means that you have obtained the education and training that enable you to become licensed or certified to practice your profession. We nursing assistants truly are professionals, but not just because we have been trained or have become certified. We are professional because we are caring and compassionate toward our patients or residents. We're professional because we have a positive attitude and a good work ethic. And we're professional because we are committed to doing our job to the best of our ability at all times. Maintaining a professional attitude requires effort, but with practice, you'll become consistently professional in attitude, in behavior, and in your skill as a nursing assistant. In order to demonstrate that you have acquired the skills and knowledge required of a nursing assistant, you will take a competency evaluation at the completion of your training program. The competency evaluation consists of two parts: a written test to demonstrate your knowledge, and a skills evaluation to demonstrate your abilities. In order to be placed on the State Registry of Nursing Assistants, you must pass both portions of the evaluation. During the written portion of the evaluation, you will have to answer approximately 70 multiple-choice questions. Although sometimes the written portion is given on paper, more and more often it is being given by computer. Either way, you will have about 2 hours to complete the test. Although you may be nervous about the written portion of the evaluation, there are several tried and true test-taking strategies that experienced evaluators recommend to increase students' chances of success even before the evaluation begins. The night before, get plenty of sleep. Go to bed at a reasonable hour so you are well rested. Gather your supplies the night before too, such as proper ID, number 2 pencils, and so forth. Eat a nutritious breakfast on the morning of the evaluation. Make sure you know how to get to the evaluation site, know how long it takes to get there, and, if possible, practice the route before the day of the evaluation. Allow plenty of time so that you arrive at least 10 minutes early. This gives you time to use the restroom or take care of any other last-minute needs. Finally, be sure to turn off any cell phones or pagers before the exam begins. During the evaluation, take your time. Although there is a time limit on the test, the time allowed is usually more than adequate. There is no need to rush, and hurrying merely increases stress and the number of mistakes. Read each question carefully and make sure you understand what you are being asked before considering the answer choices. For example, be on the lookout for words such as accept or not, which are small words that can significantly change the question. Read all of the answer choices before choosing one. Sometimes there is more than one correct answer. In such cases, the last choice will usually offer this option. Avoid second-guessing yourself. Do not change your answer unless you are certain that you have made a mistake. Second-guessing is counterproductive. If you are not quite sure of the correct answer for a question, mark the question and come back to it later. You don't want to use up valuable time with indecision, and coming back to the question may give you a helpful, fresh perspective. And finally, do not read more into questions than is actually there. Another answer might be the best one in a different situation, but you are concerned only with the situation stated in the question. During the skills portion of the evaluation, you will be asked to actually perform selected skills that you were taught as part of your training. The evaluator will want to see that you are capable of providing safe, correct care. The number of skills you will be asked to perform may vary, but generally you can expect to be asked to perform about 5 randomly selected skills. You can obtain a candidate handbook from your state that will list all of the skills that you might be tested on so you can review them ahead of time. In the handbook, the critical elements that you must perform correctly and in the correct sequence in order to pass the skill are highlighted. Many of the critical elements that are highlighted are elements that are common to all procedures. You may know them as getting ready and finishing up, and they often have to do with the principles of safety, privacy, and infection control.
In the beginning, you always go into the room, you introduce yourself to the resident, you explain the procedure, you wash your hands, you provide privacy. Those are very important measures to always remember. And of course, when leaving, when the skill is finished, you make sure the bed is in the lowest position and that you have provided that call bell for the resident. Those are common steps in just about every single skill the student is tested on.
You should prepare for the skills testing in much the same way you prepared for the written portion of the exam. By eating a good breakfast after a good night's sleep, for example, and by coming prepared. And of course, self-confidence is key.
I believe it's important for each candidate to walk into the skills portion of their competency test knowing that they can do these skills. It's just a matter of showing the evaluator that they understand how to perform basic nursing skills. You just go in and do the best that you know how to do. You don't have to get 100% on all the steps. You can miss a few as long as you're not missing that critical element, which is printed in bold in your candidate handbook. If you make a mistake during the skill, it's okay to stop, regather your thoughts, and say to the evaluator, I made a mistake, and go back and fix that mistake, and then continue on. Taking your skills examination, I just want you to remember to practice your basic principles of care, and that is safety, privacy, dignity, effective communication, and infection control.
With the testing behind you, it's time to look for the job that is right for you. Job openings are listed in a variety of places, including the employment section of the newspaper, bulletin boards in healthcare facilities, such as the one where you completed your clinical training, and internet sites. However, before you begin applying for jobs, it is important to first decide what you really want from your employment and what you will be able to offer your employer.
Candidates that are seeking employment should research the facility that they're interested in working, as well as research the job. You want the job to be fulfilling, as well as that's something that you have a desire to do in life.
Ask yourself, where do I want to work? If you like working with older people, a long-term care facility may be the ideal workplace for you. If you like working with all different age groups, a hospital or clinic might be better. Perhaps working with people in their homes is appealing, or maybe you would thrive as part of a team working in the fast-paced environment of an acute care setting. Many kinds of specialty healthcare settings exist, and in order to increase the chance that you will find a setting you enjoy, you should consider them all before narrowing down your choices. Ask yourself, do I have reliable transportation to get to work? Employers, co-workers, patients, and residents depend on your prompt and timely attendance during your scheduled work hours. Never take transportation for granted. For example, don't assume that public transportation will take you to your prospective employer. It may not. Thinking about your transportation arrangements ahead of time is necessary to ensure that you'll be able to meet your obligations to your employer and your patients or residents. If you're planning on driving yourself, do a dry run so you can see how long it takes you. Ask yourself, are there limitations to the hours or shifts I'm available to work? Your life outside of work will often help determine what jobs are suitable for you.
The shifts are very important to the candidates that are seeking employment because they It has to be conducive for the person's lifestyle. And for example, at Stella Maris, we have 3 shifts, 7 to 3, 3 to 11, 11 to 7. So people are able to select what shift that they are interested in working, and they base that around their lifestyle and what they have going on in their personal life. So it's very important.
Maybe you are taking additional schooling that occupies a portion of your day. Maybe you have young children and must be home with them during certain hours. Or perhaps you must rely on transportation that is only available at certain times. Taking your schedule into consideration ahead of time can help you balance your personal and professional responsibilities effectively. Also ask yourself, do I like to have a supervisor nearby, or do I prefer to work independently? If you like to work independently, then a home health care agency may be the perfect fit. If not, if you prefer working with colleagues or with closer supervision, then a nursing home or hospital may be a better fit. Thinking about the answers to questions such as these can help you to narrow your search, increasing the chance that you will find a job that you are well suited for and that you enjoy. Once you have specific goals in mind, you can begin applying for jobs.
Top things that I would have a candidate do prior to the interview: research the organization, check the organization. You can go online to do research. Pull up interviewing questions offline. Ask some of those interviewing questions to yourself and then maybe answer them in the mirror that pertain to the job. Do some holistic things like exercise, get good night's sleep the night before, have your clothes all laid out, and take a dry run as well. If you take public transportation, catch the bus to see how long it takes you to get there, or drive to see how long it takes you to get there. Be on time, and then come prepared too for the interview. Bring a resume, bring your references, bring a pen.
A resume is a brief document that gives a prospective employer general information about you and your education and work experience. A proper resume must follow certain rules, and prospective employers will judge you on how closely you adhere to those rules. For example, a resume should be typed or printed using a computer on white or off-white paper. A resume should use simple, plain type. It should be kept to 1 page whenever possible. It should include your full name, address, telephone number, and email address if you have one. Your resume should describe briefly your objective or career goal, and include a history of your education with most recent schooling first. And your resume should provide an employment history with most recent employment first. Whenever preparing a document for a possible employer, pay especially close attention to details, particularly your spelling and grammar, and avoid including irrelevant information such as your age, marital status, weight, religion, sexual preference, and whether or not you have or are planning to have children. In fact, it is illegal for employers to consider these factors when evaluating job candidates. Therefore, there is no reason to provide this information on a resume or during a job interview. Your list of references is simply a list of 3 or 4 people who would be willing to talk to a potential employer about your abilities or character. When considering people to include on your reference list, think about people who know you well and have worked with you in a professional capacity, such as teachers, co-workers, or previous supervisors. Make sure that the people you list are willing to have their contact information made available to others and are willing to be contacted. And of course, make sure the contact information you include is accurate. With a properly prepared resume and reference list, you will appear informed, organized, and efficient, just like a good employee. On the day of your interview, be on time, never be late, and dress appropriately. Look clean and neat, and try to appear mature and professional.
When a candidate first walks in the door, we're looking at appearance. That's very important. Mistakes that job candidates frequently make are that they don't dress appropriate for the interview. They'll come in with jeans and t-shirt and tennis shoes. A good appearance is to come dressed in business attire. We want them to be clean, sharp, pressed. Jewelry should be kept to a minimum. No dangling earrings. tattoos should be covered. Facial piercing should be taken out. We have no conversation at that point, but the appearance is the best policy because that's your first opportunity to sell yourself to the organization. So you only have one opportunity to sell yourself.
Before you go on a job interview, do some research. Look the organization up on the internet, or talk to people you know who work there.
Well, thanks for coming today, Sophie. So did you bring your resume with you?
Yeah, I have it for you.
Great.
Going into the interview with some basic background information, such as what the organization's mission is, how long the organization has been in business, and whether or not the organization is an independent facility or part of a larger group, conveys to the potential employer that you are interested in the organization and serious about the job. Maybe your research will also raise some questions you would like answered. Writing these questions down in advance indicates to the person who is interviewing you that you have prepared for the interview and that you are truly interested in employment with his or her organization. Questions you might consider asking include, what duties and responsibilities are required of a nursing assistant at your facility? May I have a copy of the job description? What qualities are you looking for in a nursing assistant? What type of patients or residents will I be working with primarily? And what are the possibilities for career growth and continuing education? Avoid asking about salary and vacation time during your first interview, as this may give the impression that your most important concerns are selfish ones. Of course, during your job interview, you will be asked questions too. Answer the questions asked of you in an honest manner.
We ask candidates in a job interview questions such as, what are your strengths and weaknesses? What brought you to this facility? What goals do you have for the future? Why did you choose this profession? If we called your other employer, what would they tell me about you?
The questions you are asked will vary from employer to employer, but other questions may include, why are you leaving your current job? How would you describe your work habits? And how do you handle yourself under stress? When the interview is over, ask when you can expect to hear from the person regarding the position you applied for. Thank the interviewer for considering you for employment, and then leave. Within a day of the interview, be sure to write a short thank you note that expresses your thanks again and expresses your enthusiasm for the job and the organization.
It definitely is important that the candidate shows interest in the job. If I only have one position available and I had 10 candidates to apply and I can only select one person, I definitely will select that person that's energetic, that seems like they're outgoing, that has an interest, that have a passion for the position that they're applying for and want to come and work for the facility.
If you don't hear from the organization within the amount of time specified at the close of the interview, it's appropriate to follow up with a telephone call. During your call, be sure to maintain your image of a professional, energetic, and interested person who would be an asset to the hiring organization. A positive attitude, the desire to care for others, a strong work ethic, and the ability to perform the job competently are the main qualities potential employers look for in candidates who apply for positions as nursing assistants. At all times, be that person, and you will find rewarding employment. Although good interview skills may help you obtain a job, good work habits, in other words, a strong work ethic, are what help you to keep a job. Having a strong work ethic means you are on time and reliable, conscientious, interested in learning new skills and taking on new responsibilities, accountable for your own work, courteous and respectful to others, cooperative, honest, empathetic, and compassionate. When you display a strong work ethic, you demonstrate that you are a professional and that you take your duties seriously. Another way you demonstrate professionalism is by practicing good personal hygiene and health habits. In order to care for your patients or residents to the best of your ability, you must first take care of yourself. The duties of a nursing assistant involve much physical effort. In addition to giving you more energy, staying physically fit keeps your body strong and can help to prevent many types of job-related injuries. Here are some tips for maintaining your physical and emotional health. Practice good personal hygiene. Get enough sleep. Eat well. Exercise regularly, including stretching. Avoid smoking and recreational drugs and limit your alcohol intake. See your doctor regularly, and last but not least, schedule time for yourself to do things you enjoy. When you enrolled in your nursing assistant training course, you took the first important step toward achieving your goal of caring for others. Now it's time to take the next steps toward achieving your goal, performing well on the competency evaluation and finding a job that will be professionally and personally rewarding. I wish you the best of luck and welcome you to what I hope you will find to be a very rewarding career in the healthcare profession.